In this video, we'll guide you through the next exercise, engaging and disengaging a Smartwire in upper anterior teeth with crowding. In this exercise, we'll be working with the upper anterior crowding model labeled 3-U. If needed, please pause this video to retrieve an engager, lingual Weingart, Smartwire plier, the upper training models, and the flat Smartwire labeled 3-U. Let's begin the exercise. Using the Weingart plier, lightly grasp the neck of the upper left central incisor locket and place it in the upper left 1 bracket. Note that the tag with the 3-U label goes on the patient's right side. Also note that because these training exercises use flat Smartwires instead of Smartwires shaped set into an arch form, you will need to push the upper left 2 and upper left 3 lockets with your finger to stay lingual to the brackets as demonstrated here. Proceed with engaging upper left 1 and upper left 2 using the same technique discussed in previous videos. When placing the upper left 2 locket, use your finger to make sure that the upper left 3 locket stays lingual to the upper left 3 bracket. To seat the upper left 3 locket, use the lingual Weingart to twist the locket to lead with the legs when seating it into the bracket, like shown here. Then use the engager to position the locket where the neck is between the occlusal tabs of the bracket and apply force with your non-dominant hand to finish engaging upper left 3. Next, proceed with engaging the upper right side. Similarly, when engaging upper right 1, make sure that the wire stays on the lingual of the brackets. Engage upper right 2 and 3 following the same technique as previously discussed. Seat the locket with the Weingart, position the locket where the neck is centered between the occlusal tabs with the engager, and push on the bend of the engager with your non-dominant hand. Finish the engagement process by double-checking that all lockets are fully seated by applying labial pressure with the engager. Next, we'll practice disengagement using both the engager and Smartwire plier, starting with the engager. Proceed with disengaging the Smartwire with the engager technique described in previous videos. For anterior teeth, position the straight end right against the tooth, line up the straight end with the long axis of the bracket, make sure to have a proper fulcrum, push down, and roll out. It's also possible to use the angled end of the engager for anterior teeth disengagement using the same technique as described for posterior teeth, like shown here. Re-engage the Smartwire again to practice disengaging with the Smartwire plier. With the Smartwire plier, for each bracket position, the tips behind the neck of the locket and gingival tab, gently squeeze and roll lingually to disengage. For better control, use your non-dominant hand to stabilize the position of the Smartwire plier when positioning the tips like demonstrated here. This completes the exercise for Model 3, engaging and disengaging an upper anterior crowding model. We recommend practicing this exercise until you feel comfortable working on crowded upper anterior teeth. In the next video, we'll work on the 4th model, which has lower anterior crowding.